Welcome to Next to Madison, a podcast to help you live your best life. Welcome back to another episode of Next to Madison. I'm your host, Madison Malloy, and on this episode, we are talking plastic surgery and beauty treatments from the inside out, what you can do at home and what you can do in the office to make sure you look and feel your best at all times. I have got world-renowned plastic surgeon, Dr. David Shafer, back on the podcast. He was back on in November. Some of you might have recognized him from the clip where he was making guys' dicks bigger. But this time we're talking more facelifts. So it is a great episode, and we will be right back with our guest on this episode of Next to Madison. Hi, it's your host, Madison Malloy. For those of you who don't know, I've written and created a powerful collection of books to help you build confidence, shift your mindset, and attract the life you truly want. From Time to Lighten the F Up, to Affirm and Flourish, Color Your Way to Abundance, and more. These aren't just books, they're tools for transformation. Grab a copy now on Amazon or at madisonmalloy.com. Now back to the show.
There's so much high-tech stuff going on right now. Literally, the next couple of years is going to be a huge explosion in harvesting the body's own healing properties to help rejuvenate the body.
So when we talk exosomes now, if you were to inject exosomes under my eye versus my own stem cells, where are these exosomes derived from?
So you could have either from a placenta or blood from other donors. Sometimes it's pooled donors, sometimes it's a single donor. So that's where it kind of is a little iffy of what's going on with it. And since it's not something that's well regulated, the consistency of it, you don't know. But what's happening, though, the people who are using them are seeing great results. So for instance, when you use them after surgery or after a hair transplant, you're seeing quicker healing, better effects. And the same thing goes for when we're using your own growth factors like the PRP and PRF. We're really seeing a boost in the patient's ability to heal after a procedure, or doing them standalone and just seeing the skin looks rejuvenated after you inject them. The other crazy thing, which I don't know if you're going to ask or not, but the whole salmon sperm thing, and that's a whole nother thing within the same realm where you're using cellular elements, but this is DNA material coming from the salmon, and what they found is it really helps boost the rejuvenation of the skin. So people are using those topically, people are also injecting them,
and that one's called
really fighting
PDGRN is the other word that they're calling.
I think are the initials, but what it is using those dermal elements and cellular elements that they got from the salmon sperm, but using them for rejuvenation cosmetic methods, and they're getting some good results with it.
So if you were to use the exosomes derived from blood or a placenta or a donor, will your body reject it because it's not you? Like, if I have a liver transplant, I have to take medicine because my body would reject it because it's somebody else.
No, that's a good question. And what they're doing is isolating just those active factors, but removing anything that could be antigenic, meaning your body would compete with that or try to remove it. So you're not getting that reaction. When you use your own tissue, of course, you're not going to have that issue. With the exosomes, it's just the cellular element, so the antigenic part is not there. There's a company now that even found a way to use fat from a cadaver, remove the antigenic portion of it, and now for a patient, let's say they're on Ozempic or they lost a lot of weight, but they need fat grafting, but they don't have their own fat. Now we can take this cadaver fat and use it for patients. And I'll tell you, I thought I would present that to a patient and they'd say, no way am I getting cadaver fat. But it kind of, as soon as they hear like, oh, I don't have to have liposuction to get the fat. I could just have it injected and go home the same, procedure. And they're like, let's do it. So that's a huge new product coming out that we've been using for about 6 months now.
Wow. It's just amazing, like all the technology. I mean, that's happening across every industry, but especially in the beauty industry.
Yep.
So when you're also saying, I want to go back to something you repeated earlier about people harvesting their blood younger relatives stuff, like so I have a niece, she's my little twin, and she's going to be 11 on Wednesday, and so I gotta take her on a shopping spree to get her blood.
No, but the best thing would be to save your own blood or your own fat from when you were younger. And even when your baby's born now, you have the option to save the cord blood, which sounded crazy years ago. And they're like, what would I ever do with this? But now they're coming up with things to actually do with it. And so the people who did that a long time ago have their own cells, but younger cells, which they can use. But there's ways to use first-degree relatives or people with matching blood types and other factors where they can actually use it in other people. So it's
Oh
it's,
my
it kind of
gosh.
sounds like something out of like Star Trek or something
Well, my
from the
mind went
future,
to
but
my mind started to go to the conspiracy theory about the freaks and the drinking the androgen, or what was it called, adrenochrome or something. Yeah, that's not this.
But
That's not this.
I won't get into it, but there may be something to it,
But right,
it
but
might
like that's
actually
not
work.
this. Yeah.
But you also can't forget traditional plastic surgery, because there's things that these new high-tech, either energy devices or cellular treatments can do, but there's still a role for traditional plastic surgery. Because if you have to take your fingers and push your skin back, you still need to have a facelift, right? But you can use that in conjunction with these new technologies to help rejuvenate the skin, help the healing be faster. So it's not this or that. Usually it's both combined together to get even better results than you used to have before.
Right. Okay. So facelifts have changed so much, right? You had the comedian that passed away that I loved more than anything, Joan Rivers, who just looked very nipped and tucked.
Yeah.
And then you see a lot of older women, unfortunately. They wanted to look young too, but we didn't have the advancements now.
Sure.
So what is a typical healing process of a facelift? Because people are doing them younger and younger now.
Yep. And it's amazing you bring up Joan Rivers, because back then she was ahead of her time, right? So she looked a little nip and tuck, but now you look back at her and she doesn't look crazy compared to some of the crazy stuff we're seeing now, right? So she was ahead of her time. She was pushing the limits, but she was really a trailblazer in this field. But there's certainly been refinements in terms of the anesthesia safety, the surgical safety, the techniques that we're using, smaller incisions, a more precise anatomy, combining with laser energy treatments or cellular treatments that can help with the recovery and help boost the results. So there's a lot to go into it, but it's still surgery. So there still is a recovery. And I always tell people you have to think about recovery in 3 phases. So a couple days, a couple weeks, a couple months. So a couple days after any surgery, everything revolves around that you just had that surgery. So you might be taking some pain pills, some anti-inflammatory, maybe antibiotics for a couple days, resting. And then you're going to have a couple weeks where you're starting to get your energy back, you're moving, you're getting back, but you might not be going to work yet because you still have some stitches or staples or some swelling, possible bruising. But that fades over the first 10 days to 2 weeks. And then you're going to have a couple months where you're back to your activities. You can kind of hide the incisions as they're healing with your hair. We're doing some laser and other treatments to help improve that. But you're getting back to your activities. So it's not a bad process.
No, it definitely seems a lot quicker. But they're getting younger and younger. So what is the youngest person you performed a facelift on?
People even in their 30s are getting facelifts now. But you can't go by the age, because the age is just a number. And so you're evaluating the patient. So if you have loose skin, let's say they lost a lot of weight, now they have all the skin, you can't exercise your skin away. You have to remove it surgically. So it really depends on not doing cookie cutter procedures, but individualizing it to each patient so that you can customize their treatment plan and come up with a way for them to reach their goals that they're looking for in the safest possible way, whether it's surgery, laser, cellular treatments, or all the above.
Okay. So the verdict is out. People are saying yes, no. Lindsay Lohan, does she have a facelift?
Well, a lot of these people, they look very good. But this is what I say about celebrities. The celebrities have really great people around them. They have makeup artists, they have their digital retouchers, they have great hair, all these things that go into looking good. So when I see them in my office, they look a lot different than what they look like on the cover or in a video or picture.
Yeah, okay.
So really, you shouldn't look at those people and set those as their expectations of what you're going to look like, because if you did all those things too, you would also have that appearance. But certainly they're celebrities because they have some super talent, they have really good genes and real good looks to start with, and they've been doing little nips and tucks along the way, which is why people are starting earlier. So instead of a celebrity waiting until they're 70 years old and doing a major transformation, they're doing monthly or quarterly treatments. They're doing great skin care. They're doing lasers and other things that are help boosting them along the way. So that way it's a slow transition and they're kind of aging gracefully or aging without the years, versus when you see a celebrity who makes a major change after you used to look how they look, and there's that Renee Zellweger she had those heavy set eyes and a very distinct look, and she had a blepharoplasty, right? And she looked completely different and unrecognizable. Or Jennifer Grey had the rhinoplasty, and it kind of changed her career pathway. But it's because you get to know a celebrity and how they look. And if they change something too drastically, then it doesn't look like that celebrity anymore, even though they might have a really good textbook nice result, but it just doesn't look like them anymore. So when I'm doing surgeries on people, my goal is for people not even to know they had surgery, but for somebody to see them and say, wow, they look good, but not actually be able to put their finger on what it is. Like, that's a good result. Or if you're getting filler or Botox, it shouldn't be obvious from across the room. If it's obvious, then that's not a good job. And over 5 million people a year get injectables. And that's a great statistic, because you see the random people in the gossip column or on Instagram where like, what happened to them? But really, that's the exception and not the rule. So really, the vast majority of people who get treatments done, they look great. And it's not that they look freaky. It's the kind of exceptions or where mistakes were made and decision making along the way. Or some kind of healing issue, or maybe they weren't a good candidate for the first time. That's where you see people who don't look that great.
So 5 million globally or nationally?
Nationally.
Okay. So we've got, 350 million people in this. So that's still a pretty small number.
Still a very small number, but if you look to your left and your right, there's probably somebody who's had something done, but you wouldn't know because they look good. And I'll tell you, people, even good old Botox, it's been around for 20 years now. Every month or so you're hearing about a new use for it, a new FDA indications. The latest one is on the neck, which is really great. But you see people, if they've never done it, they're kind of a little negative about it until they try it. And then they have this aha moment. And then it's like, wow, now I understand why people get this. And the same thing goes for surgery, like let's say liposuction. So I operated on a person one time and we did lipo. They looked amazing. She goes, now I understand how all the celebrities look so good. And they deny that they had anything done, but we all know they do a lot of stuff.
Well, yeah. I mean, I think if I had unlimited funds to spend, I would definitely do that thing that contracts your butt muscles and your ab muscles. What is it, the M-Sculpt or something?
Yeah, no, there's another one called True Body and M-Sculpt, but they're using energy to help stimulate your muscles, and it's like sitting down and do 30,000 sit-ups in one sitting or 30,000 squats. And so it's not a one-time thing. It's not like you do it and then forever you have this very perky butt. But you do it almost in conjunction with going to the gym, but it's really boosting you, taking you to a level that you couldn't get to if you were just going to the gym.
Well, because if you did 30,000 squats, you'd probably be dead. So speaking of that, somebody had given me a trial for it, so I tried it, and I was like, okay, when I get rich, I'm going to put one of these in my house.
Celebrities actually buy them and have the machines in their house.
Oh, I'm sure they do.
Then we kind of train their staff that's in their house to do the treatments on them there. So
that's amazing.
There's this whole world that people don't know about. And then again, that's why you can't compare what some celebrity does has with what's realistic in the real world.
Exactly. And so the other thing, so you've had a lot of notoriety this summer. You've had a lot of great press. You were in a New York Times bestselling book by Emma Rosenblum called Mean Moms.
It's amazing. I got a text message from somebody. They're like, I'm at my book club, and all of a sudden I see Dr. Shafer go for Botox. And so she sent me a screenshot. I didn't even know the book was coming out. And so it was a really great thing to have somebody actually write that. And it was a fun surprise. We put it in our waiting room now so people can see it. But no, it's really great to have that kind of recognition.
But then you were also on a reality show with the Brooks Naders and her sister,
sisters.
Love Thy Nader. I don't like reality TV that much, but I got into that one. Yeah. They're great.
I mean, they're really great, and they're very entertaining, and it's called a reality show, but it is real life. Like they're like that in person, and they're really fun. It's a really great family, and I think that's why people can kind of identify with them. They're real people. But they also have a very exciting life. So it's
I know, and I'm a straight woman, but like Brooks Nader is like the hottest person ever. I'm like, Shafer got to see her vagina.
To have my so about 10 years ago, I was on The Real Housewives, and
Okay.
The patient I was seeing, one of the people from the show, had a vaginal injury, and they show me examining her vagina to see what if it needed any stitches or anything. And then you fast forward 10 years later, and here we are doing another reality show, and I'm there with my head between their legs, looking at their vagina. This time doing laser and salmon sperm, and no, but it's a fun field to be in, because not only do you get to be a doctor, you get to take care of patients, but there's this fun aspect to it too, where you're helping people, and you're able to meet very interesting people within plastic surgery, but also being here in New York. It's a really great thing to come to work every day. You don't know what to expect, who you're going to meet, who you're going to talk to, and have some fun while you're doing it too.
But you've become a celebrity yourself.
You know, I don't consider myself that, but it is. Knock on wood. I've been very fortunate, and it's nice. It's fun to have some of these extracurricular things that I do, whether I'm meeting a celebrity backstage to do some last minute tweak before their appearance, or even flying halfway around the world to treat them before a party or something.
Have you done that?
There's some fun things that are kind of, not the 1%, but the 0.001%, where we take care of them, or even like flying to the Middle East and taking care of royal families and stuff. It's been fun, and it's a great time.
Yeah, and then you were recently, I saw. You did a panel with Andy Cohen.
Yeah, that was just last week, and he was really fun, and it's great. So I work with a lot of the companies, and one of the companies is Allergan, the maker of Botox. And so I go around the world and the country teaching Botox. I just got back from San Francisco a couple days ago.
Nice.
Part of what they're doing is a new campaign, and it's unbranded, meaning we don't mention brand names, which gives us more liberty in talking about the products, possible complications, treatments you should get, and it's really nice. So they assembled a panel with 2 plastic surgeons and 2 well-known dermatologists, Dr. Engelman, who's also in my office, who you'll see on TV a lot, and then Andy Cohen, and it was just like a real down-to-earth talk about fillers and Botox and what patients should expect and what to look for moving forward, and things to ask your doctor, and things to be worried about, what to expect. So it was a really great panel. I'm looking forward for it to be released.
Yeah, no, I mean, it's amazing, but it's good that there's more education and more awareness going into this, because we have had a ridiculous amount of med spas open up, that they're called.
Yeah.
And now you basically can go to a course and start doing injectables. But we get a lot of complications. I had my lip filler done by somebody in Denver before I met, obviously, you. And I had to get that thing all dissolved all the way out, because it was just... And
thankfully now we can dissolve it. So in the past, we couldn't even dissolve filler. So a patient would come who was injected somewhere with a lump or some issue, and they're pretty much stuck with it until the body metabolizes it, or hopefully they didn't put silicone, and that, permanent fillers lead to permanent problems, and like silicone is one of those. So now with the hyaluronic acid products like Juvederm, there's an antidote, an enzyme which we can inject that melts it and makes it go away even within a couple hours to days. So these people who were walking around with lumps, and then the enzyme came out, it was like a miracle for them. But since I've been injecting for over 2 decades now, part of my practice is seeing people who did have problems at other offices, other injectors, and then working with them to help them either correct it or course correct or melt it, whatever needs to be done. So it is kind of, again, an unregulated industry where, you can go to any corner in New York and people are injecting, but that doesn't mean you should be getting injections there. So if the price is too good to be true, if the promises are too good to be true, if the environment isn't medical, like if you're in somebody's basement or living room, or, somebody's getting their nails done right next to you while you're having a medical procedure done, like maybe you're not in the right place. So think about what you're doing. And, definitely it's not cheap, but I had a professor one time, he said, you get what you pay for. And
You do.
you're paying not only for the product, but you're paying for the expertise of the person who's doing it, the environment that you're having it done, and then the wherewithal, if there happens to be a complication. Nothing is without risk, but if there's any issues, to be able to handle those issues.
Yeah, no, absolutely. Because, and then the big thing though, that is the lip filler.
Yep.
But the problem with the lip filler, I've had to take it out because I've had problems with it. It just didn't fit. There's a lot of migration.
Yeah.
So you didn't hear the term really migration when people were doing fillers in their folds or their other places. But with the lips, it's very common. Like, how can people avoid that?
Yeah, so a couple things. So like a cheek has a much larger surface area and capacity for volume.
Right.
The lips is a much smaller capacity. And the example I give is if you take a glass and you put it under the faucet running, eventually that glass fills up with water. If you don't take the glass away from that running water, it's just going to keep spilling over. And that's pretty much what migration is. So if somebody gets a little bit in their lips and it looks great, and then they go back and they're like, I want more. Part of my job sometimes is to say no. I said, we've kind of reached your limit. But if you overfill something, it has to go somewhere. And just like that water will spill out of the glass, that filler is going to start going around the lips to, it's not going to go from your lips to your ear to your elbow or something, but locally it's just going to expand a little bit. So doing things in moderation, not doing them too often. And we're finding that in some people, not all, but some people, the filler is lasting a lot longer than we were thinking. And so you might not need to do it as much as you used to or thought you had to. And so that's, again, where an injector can be either a technician or they can be an artist. So you could do everything cookie cutter and not really put any thought into it. And it's just like an assembly line. And that's where you get problems, right? Or you can be an artist and we have all these tools. And the more and more the time goes by, we have more and more different fillers and they all have different properties, which are good, but you have to be able to have that eye and that talent to use the right filler, the right amount, and the right location of the patient. It's not just the location, but it's the depth, it's how much you're putting, it's whether you're using a needle or a cannula. So really a lot goes into it. So an example I give is you could have the same set of ingredients and you could give them to, let's say, me, and I could cook a pretty decent meal, or you give them to like a Michelin star chef and they're going to take the same ingredients and have this amazing meal, right? And so you can take the filler, it's not the filler's fault, but you could take the filler, have somebody with little to no experience, or you could have somebody with a lot of experience and get completely different results. So I think it's very easy for people to blame the filler, but there's, the blame needs to be spread around a little bit.
Right, exactly. So what are you hearing as far as like, let's say fast forward 10 years, it's now 2035.
Yeah.
How do you feel that facelifts are going to be different? In your opinion, like from what you're kind of seeing in trends?
With the cellular medicine and the energy-based devices, we're going to see more treatments leading up to and after the facelift, and we're going to see changes in how extensive the facelift has to be. So instead of, when I was going through my training 20 years ago, we were making incisions all the way across the head and, these huge incisions. Then the short scar facelift came out, Botox came out, so you no longer had to do as much on the brow. So it's really changed over the last 20 years, and it's just going to keep changing where we're able to do through smaller incisions, but you still need to make an incision. So surgery needs to have an incision. And so, there's patients that come in and they say, well, I want a facelift. They push their face back. I want to look like this, but I don't want any incision. I don't want any recovery. And I only want to pay $1,000, right? And so you also have to be realistic. And that's where there's been this kind of paradigm shift where instead of getting everything done at one time, is your journey over time. And so we're starting earlier, but not as extensive, and doing like that saying says, little dips and tucks along the way, but really building up to the final result instead of waiting till it's so bad that you have to, it's like an emergency facelift because you look so bad, right?
Yeah.
So just the little tweaks along the way, but also doing the big surgeries when needed.
So what's the difference between a minor well, I don't know what they call it, minor
Well,
facelift
you call
versus
it
a
like,
deep plane
I mean,
facelift.
there's definitely different terms, and a lot of them, some of them describe what's happening with the surgery, but some of them are kind of marketing techniques as well. So there's no special magic that one surgeon has over another in terms of the type of facelift. Certainly, people are more talented at doing surgery, just like in any field. Somebody playing music or singing, some people are better than others, right? So, but they're still singing the same song and still looking at the same music. And so same thing with surgery. It really depends on, the technique that's being used. And there are different techniques. So there's a very popular term right now called the deep plane facelift.
That's what Kris Jenner had, right?
Yeah, but there's nothing new to it because this has been around for 20, 30 years. And basically, there's a muscle layer underneath of the skin. And either you can dissect on top of that muscle and pull it back, or you could lift up the muscle and go under. So it's kind of like if you were going to pull the sheets up on your bed, you could grab the top of the sheets and pull them up to your chin, or you could turn your hands and go underneath the sheets and pull them this way. Both ways pull that sheet. And so it has to be individualized to the patient. So some people who need like that extra pull, it is better to go underneath and pull it because you get a stronger pull. But some people, that wouldn't be the right procedure for them, and then they're going to get this over-pulled look. So just because it's a term you're using and then it's being marketed and Dr. Instagram, you're hearing a lot about it, doesn't necessarily mean it's the best one for that patient.
Okay.
And that's the importance of going to a board-certified plastic surgeon, discussing your options, hearing what alternatives there are for the surgery. And then I like to partner with my patients. So there's, it's an informed process. We're making that decision together and coming up with a good game plan.
So how much kind of, I don't know if this is the right word, but like psychology do you do? Like if somebody comes in, because sometimes there's people that just want to change things and because there's another issue.
Yeah.
There's a deep insecurity, that they have an abusive partner, they got dumped for somebody how much of that do you start to see to where you're like, wait, this is a psychological issue and not a plastic surgery issue?
So that's a huge component of plastic surgery. And it takes being in practice for a while to be able to be good at identifying it. When you first start out, you want to save the world and do all these crazy operations that you've been reading about and learning. And then you realize there's this subset of patients that no matter what you do, they're never going to be happy. Their motivation for doing the surgery is unclear or has nothing to do with their physical anatomy. They could have what's called body dysmorphic disorder. So they look in the mirror and they don't see what everybody else sees. Like they could be as thin as a stick and they're looking in the mirror and think they look fat. And so they'll come in for liposuction, but there's no fat to suction because they're so thin. And so being able to identify that ahead of time so that you can get them the proper resources, which most often is not doing the surgery, but getting some psychological help, getting some whatever medical help that is needed so that they can, address those issues in their life. Because you could do a surgery, it could be textbook perfect, and they could come back, they're still unhappy. It doesn't have anything to do with the surgery. You do have to take the time to talk to patients, and so you can understand why they're doing it, what their expectations are. I always tell patients you can't use absolute terms in saying what you want to have. You can't say, I want to get rid of this wrinkle or I want to eliminate this fold. They have to use words like, I want to soften the fold, I want to reduce the wrinkle, I want to enhance my cheek. So if you can use terminology like that to describe what you're looking for, I have a much better chance of making you happy. If you're always using these absolute terms, like get rid of, there's no getting rid of. It's always going to be you. So you could take a piece of cardboard and fold it in half and then unfold it. No matter what you do to that piece of cardboard, it's always going to have that crease in it, right? Yep. And there's no iron or no whatever that you could do to make it go away. So I could pull that cardboard so tight, it's still going to have the crease. And same thing with the face. Another misconception with facelift is that if you're pulling the skin, that the texture and the color of the skin is going to improve. But that's different. So you have to think about different layers. So we're redistributing the soft tissue, we're pulling the skin, but the texture of the skin, like the crepiness of the skin, skin, the pigmentation in the skin, that's laser. That's the exosomes. That's the PRP and PRF and other treatments that you do at the same time. So it's not just coming in and doing a quote unquote facelift, but it's the whole package. It's getting laser, it's getting possibly some fat transferred, or the alloclay, the cadaver fat, or the PRF, other things to help enhance the results, that treat all the different layers of the skin, not just the deeper layers and not just the superficial layers.
Interesting. Okay. So before we have to wrap up, let's talk about, this is all in-office procedures, but in order to help your in-office procedures, you got to be doing stuff at home. What do you recommend for somebody that's listening? What should their nightly and what should their morning routine look like?
Yeah. And it's more than just like a medical skincare routine, which we'll get to in a minute. You have to eat healthy, right? You have to not smoke. Like, the one thing people could do is not smoke, because if you smoke, you're depriving your skin of oxygen. You're causing inflammation. And we've all seen those people that look like a leather bag. There's no surgery that I can do to reverse 30 years of smoking, right? Drinking alcohol in moderation. You've all seen what people who drink a lot look like, right?
Yep.
You have to hydrate really well. Drink a lot of water or other fluids that help hydrate. You have to exercise. You have to get your blood moving. You have to get that oxygen moving. And there's so many trends now. People wearing those those smart rings and smart watches. And I have one too. I just got it. And you're monitoring the oxygen. But it's real, because there are fluctuations in the oxygen. If you're not getting off that couch and you're a couch potato, you're never going to maximize your potential. So there's all of that. And then there's medical grade skincare. And that's using active ingredients. And, everybody's heard of retinol. You've heard of hyaluronic acid. There's so many things that go into it that can really help with the patient to do on a daily basis. And then on a monthly or quarterly basis, lasers, facials, energy devices. And then quarterly, the Botox, if you need some filler. And then there's the surgeries as needed, which are bigger events along the way. So again, that's why we call it now the patient's journey, and not just having, your plastic surgery procedure and moving on.
Right. So the moral of the story is, if you want to look good, make a lot of money. We'll go into the abundance training next.
But there's things you can do, right? And I always talk to patients about that journey and where we start on it and what we're going to do depending on their budget, right? And believe me, I didn't come from means, and I understand what you have to pay the bills and the rent and everything. But there's little things we can do to help people. Like, the number one thing that somebody could do for their appearance is Botox. And it's not cheap, but it's not as much as doing a facelift. But until you have the aha moment and you try it the first time, and then you realize that you could spend all this money on creams and lotions and potions, and they're never going to do what Botox can do. So if there's one thing that somebody could do, and even though it's been around now for 20 years, is get started on your Botox, because there's the immediate effect that you see, but there's also the investment that you're making in your skin over time, because you're reducing that stress in your skin and really changing the physiology within your skin so that it can age much nicer.
Right, it's like that. It's that cardboard example you used.
Yeah.
Don't crinkle your canvas
right?
before you have to.
Exactly.
Prevent the
right. Prevention is the key.
Yeah. So, and then what? Obviously, sunscreen.
Oh, yeah. I mean, that's a whole other thing.
Yeah.
Sunscreen, and not necessarily sunscreen, but physically blocking the screen. There's a lot of talk now about putting chemicals on your face and those things. So it's almost better to wear SPF clothes that cover your skin, or a hat with a brim so you're in the shade, and then the chemical sunscreens or blockers as needed. But truly physically blocking it is even better than putting a chemical on your body.
Because that was a big thing too with the sunscreen. Is they said the increase in skin cancers did not happen until there was an increase in sunscreen marketing. Yeah,
and who knows? Does the chicken or the egg come first? Who knows? But also, and I might be a little controversial here, you need your vitamin D. So you do need a little bit of sun exposure.
You do.
You do need to get some fresh air. And so there's people that come in that look so pale and pasty, and they don't look healthy, and they're kind of overdoing it. So you have to do things in moderation. Yeah,
no, absolutely. And do you do a lot of grounding? Grounding's a big thing, where We can't really do it in New York City because it's disgusting.
There's no ground where
it's safe.
but so it's funny. I like to garden at our country house, and one of the things you can do is take copper wire and kind of twist it up and then put it in the ground near your plant, and it actually can help my plants did better this year after I read an article about that. But I guess you can also take those wires and have grounding blankets and have a wire that goes to the ground. But I think it's maybe.
They said just stand barefoot.
Yeah, I mean, I used to love walking around barefoot in the grass when I grew up at camp in the summertime. I know, right? And in New York, you'd be crazy to walk around barefoot. You get stabbed with a needle or who knows what on your feet. But there is something rejuvenating, and people love going on vacation and walking on the beach in their bare feet. And whether it's something physically happening or something mentally happening or just connecting with the earth, there is something healing about it.
There is, absolutely. So you also, you don't just do surgery, you guys also have a huge practice. Yeah. So you guys also have a lot of kind of anti-aging protocols, like a longevity center. So tell us about some of the things that you guys are doing there. Are you doing NAD stuff? Yeah. Like talk about...
We kind of do all the above. And my goal was to make a very comprehensive, almost like wellness center. And, my role in that is doing the plastic surgery and some of the injectables. But we also have dermatology. We have ENT. We just brought in GYN. So
did you?
Truly, yeah. So truly...
They take insurance?
No insurance. So this is New York. So it's...
Oh, okay. So it's not an OBGYN that you go to
well, it's out of pocket. For people not in New York, it might not make any sense, but a lot of doctors in New York can't take insurance because it's just not affordable.
Right.
And where the line between kind of elective and medically necessary things kind of is blurred a little bit, and people in New York are kind of progressive in terms of things they're looking for, but there's things that are within the GYN realm that are part aesthetic, part medical, and that's where they come in. So they do have their own medical practice for some insurance covered things, but also in our office doing kind of cutting edge things that aren't even on the radar of insurance companies. But we have that. We have our whole laser center. Yeah. Now it's better to call it energy center because there's more than just laser. There's radio frequency, there's ultrasound, there's plasma energy. I mean, so many cool things. But then there's our whole metabolic center. It's called Advitum, the Metabolic Center. And basically that's treating you from the inside out. So we're looking at your labs, we're looking at your body composition, we're using really high-tech tools to test your body and then come up with a customized treatment for you. And you hear a lot of people having complications who are on peptides and other metabolic treatments. That's because they're buying them online or they're getting them from some med spa. But we're taking that to a whole nother level. I have practitioners there that their sole job is to research what's new and what's the greatest and make sure that everything has a scientific basis to it. But we're doing NAD drips, we're doing glutathione, we're doing all the peptide treatments. And I'll tell you, I'm not just the doctor, but I'm the patient too. And I look back at pictures from 10 years ago, I'm in better shape. I look at my laboratory values and they're all within perfect range. I look at my cholesterol, my blood pressure, my energy level, my sleep that I get. And so there really is something to this, but it's a comprehensive treatment that you have to do. Again, it's not just doing one thing and then moving on. So it's monitoring it, adjusting it as you go. But you can really, we're at that place. We're not physically aging backwards, but we're seeing our patients looking much better than they did 5-10 years ago, even though they're 10 years older.
Right, which is it's just amazing. So what do you think about collagen, like powdered collagen in your coffee, like the Vital Proteins, for example? So there's the build. I used to think it was all hocus pocus, but when you think about it at the cellular level, you do need to have those building blocks for building the collagen, right? So how effective it is if you're rubbing it on your face or eating it or injecting it, somehow you have to get it into your body. But that's where that whole balanced diet comes in, getting, exercise, you get the oxygen, all of that goes into it. But also supplements can help. But again, supplements within moderation. Anything can be a poison if you take too much of it. So you don't want to overdo it, and do it with the guidance of your doctor. Okay, perfect. And then you mentioned glutathione. That's been you constantly see the ads on social media for glutathione.
Yep.
like the liquid packets specifically.
Yeah.
What is that?
So it's a very strong antioxidant. And
Okay.
so if you live like living in the city here, we're exposed to oxidants all day long in the
Oh,
air,
gosh.
in the environment, things we're eating.
Yeah.
And when you can put something in there that is kind of like a scavenger. So imagine like the Roomba vacuum going around your apartment and it's constantly like going around, getting dust off of the floor. Just think about we're putting these molecules in there that are going in there and getting all these oxidants and converting them and neutralizing them. And I'll tell you, patients, we give them glutathione immediately in the recovery room after surgery. That fog from anesthesia goes away much quicker. They feel better much faster, and they're healing quicker. So glutathione can be a one-time thing with surgery, or it can be a regular thing that you do. But the NAD, if you think about it like the fuel for all your cells. So if you're driving around on empty, on fumes, then you might be putting along, but not really making any progress. But if you can really supercharge the fuel within the cells and get all the cylinders pumping and get that like high octane grade fuel into you, like that's kind of what NAD is doing. And you don't want to push it in too fast because then your body will, won't be able to handle it. And so that's why, especially NAD, should be administered in the medical environment. A lot of times we put people on a monitor this first time, because otherwise your heart can start racing. You can feel it. So you do it over a slow amount of time, the first couple treatments, and build up your body's reserves, and then you can start doing regular treatments with it.
Okay, gotcha. So obviously the IV is the most effective, but if you can't necessarily afford the IV, are the liquid packets that you buy at
they can be effective. Again, you're not gonna get as much absorption of it. It's not gonna, but again, if you're doing it more often but lower quantities, you can definitely supplement yourself with it.
Okay, interesting. Okay,
just don't buy any crazy stuff like online that you don't know where it came from or what exactly the ingredients are, or if it's promises on the packaging like too good to be true. I mean, really, you have to be smart and things that don't believe Dr. TikTok. And then lately it's Dr. AI or Dr. GPT, and people come in, thinking that they know everything about something, but truly they've just been going down this rabbit hole on some AI site, and a lot of that, I mean, AI is going to be great in medicine, but right now it kind of cherry picks stuff from different websites and comes up, and you can tell when it's like not making sense. And so you still have to have the human doctor there with the BS detector, I like to say, where like, or just saying like, this doesn't make sense. And it might make sense to the AI because you got it from this website or that website, but AI still isn't good at sifting through what's propaganda on websites and what false claims and what is true medical science. But that'll come. I mean, there's going to be some really great advances with AI as in the next few years as well.
Well, it's amazing. I mean, I'm one day I'm not against a facelift. I will get a facelift, but I'm just praying there's so many advancements that it'll be like a lunchtime facelift and I'm back.
I mean, definitely recovery will be better. The risk, again, you can never be without risk, but much lower. Healing will be faster. So all those things, I've seen dramatic changes in the last 20 years being a plastic surgeon, and I'm looking forward to the next 10 to 20 years seeing more changes.
Absolutely. So, well, thank you so much for coming back on the show. Look at the camera and tell everyone where they can find you, follow you, come see you, all that good stuff.
So I'm Dr. David Shafer. I'm a board-certified plastic surgeon here in New York City, and I'm the medical director of Shafer Clinic, which is in Midtown Manhattan. And you can just go to shaferclinic.com or come visit us at 44th and 5th Avenue in New York City.
It is a beautiful place. You guys definitely check it out. This guy is the man. The reason celebrities look so good in the city is most likely because of this guy right here. So thank you so much for coming on the show yet again. And thank you to everybody who's listening, wherever you may be. We will see you next time to find out who's next. Bye. Hey, your host here, Madison Malloy. Please make sure to subscribe to the show on all podcast platforms, and please rate and review us on iTunes and Spotify. Also, if you have any questions or comments, you can email us at contact@nexttomadison.com. I thank you again for listening. Bye.